Let me help you get comfortable with what to do if your child bumps their head or sustains a head injury. You remember when they said to keep your child awake as long as you can every time they bump their head? That's not necessarily true anymore, and a lot has changed. Head injury is one of the most common complaints I see as a pediatric ER doctor, and it's typically stressful for families. By the end of this video, you will know what questions to ask yourself when your child bumps their head, what to do, what to watch out for, and most importantly, when to get them checked out immediately. I'm trying to reduce anxiety that comes with head injuries and head bumps, but also know when to get checked out even when your child is acting completely normal. Number one, how is your child acting immediately after the fall or the head bump? Of course, if your child is unconscious or in a critical location or position, you want to call for help immediately. But let's say they're not, your kid is conscious. Let's get a little specific in what we want to ask exactly. Let's say assume you had no idea your child bumped their head. Would you be worried about the way they're acting, eating, sleeping, or walking, anything at all? If you are, then it's best to get them evaluated. Maybe something is off. But if on the other hand, you're not concerned about the way they're acting, eating, sleeping, they're not acting abnormal, it's okay to observe them at home and then follow the next step, which I'm going to discuss now. Number two, what can you do while you're watching your child who just bumped their head at home? Most of the time, when babies and kids bump their head, they're either going to move over to you, a loved one or a caregiver, crying or just upset and overwhelmed. That's a normal response because it probably hurts and their head aches. Some other kids may actually move on and continue playing and they're unbothered, and that's because the bump may not be significant enough and their body is actually taking care of it at the time. So it's okay to leave them alone and continue to observe. During the time immediately after the bump, maybe between 20 to 30 minutes after the bump, a lot of kids may be uncomfortable. So give them some time to relax, lay on you, lay next to you, or even just cuddle. Not only are they in pain because their head probably hurts, but some others, their brain may be shaken up a little and they're still trying to settle for them to feel better. So during this brief period of observation, some kids may have 1 to 2 episodes of vomiting because they're overwhelmed or maybe the brain has been shaken up, and that's not unusual. If you're noticing multiple episodes of vomiting, we're going to talk about it in the red flags of what next to do, but in the moment, I want you to observe if it's just 1 episode of vomiting and they're still feeling okay. So during the time immediately after the head bump, you want to check the area of the head where they bumped for any swellings, open cuts that needs evaluation. You also want to give them some pain medication like acetaminophen to help with the pain and the generalized discomfort they're feeling. Placing an ice pack or cool cloth or frozen veggies over that area can also soothe and make them feel better. Hydration is also an important one that can make babies and kids start to feel better, especially when they're feeling overwhelmed. So let them rest, let them cuddle on you and observe for red flags while you assess for how they feel after this initial resting period. Number 3, how are they feeling after the initial resting period of the time after they bump their head? If they are able to get up and continue the activities, continue playing around the house, it's okay to let them be and continue to observe for the next 4 to 6 hours and during the whole day. If just after this period they fall asleep suddenly, maybe they go from talking to you, responding to you, to falling deeply asleep, and you're unable to wake them up, unable to respond to you, I want you to take them to the nearest emergency room to get an evaluation. It is possible your child may be resting from the injury, but a child who suddenly falls asleep after a period of being responsive and is unable to be waking up may be concerning for a brain bleed. If on the other hand, your child falls asleep next to you or in their bed and you're able to tap them and they easily wake up and respond to you, it is okay to let them sleep. A really old recommendation was to keep kids awake for 4 to 6 hours after a head injury just to make sure they're okay. What studies have noticed that actually makes their symptoms worse and makes their symptoms progress. Because brain rest is actually a form of recovery, keeping them awake to be able to assess them and not letting them sleep actually makes their symptoms progress. And when they come in or when they need evaluation, it's difficult to tell if this is due to the head injury or because they're not getting enough brain rest because families are not letting them sleep. So yes, you can let your child sleep. You can monitor them for the first 20 to 30 minutes after head injury to make sure they're responding to you, to make sure they're acting appropriately. After that, you can let them sleep and maybe check on them every 2 to 4 hours and just make sure, tap them and make sure they're responding to you. Get concerned if your child is deep sleeping so deeply and not being able to arouse. That is when I want you to seek care immediately in your nearest emergency department. Number 4, what about the vomiting, and what amount of vomiting episodes should I be concerned to get them seen? Vomiting from being overwhelmed and the incident usually happens 1 to 2 times and they calm down, and kids generally either move on or just decide to rest or do their regular activities. Vomiting due to a concussion or a brain bleed may be more difficult for you as a parent to be able to decide. So if they're vomiting more than 2 times or maybe having other symptoms that's concerning, we actually want to see them either in your pediatrician's office or in the ER so we can make that decision, we can evaluate them, we can check them out, and we may even consider a CT of the head to make sure there is no brain bleed that we are missing due to that's manifesting as persistent vomiting. Consider the brain to be like a compartment that contains a lot of structures that don't move. So there's a part of the brain that's bleed and it tends to shift the brain structures and everything else, and that can also irritate the lining of the brain and cause the child continue vomiting persistently. But in addition to that, they tend to have other symptoms we actually can see on examination. So that's one of the reasons why we recommend if your child is vomiting, has 2 episodes of vomiting after a head injury, it is always best to get them checked out. Number 5, what are the red flags you need to watch out for when your child bumps their head to make them get seen either by the ER or by your regular pediatrician? So this is a long list that's going to vary by age. Not all of them are common. You can possibly be able to take a snapshot. I'm also going to leave it in the caption below so you can easily have access to it when you're concerned about your child having a red bump. If your child has a convulsion, which is a seizure after the head injury, any abnormal behaviors that's different from baseline from what they were before the head bump. If your child has any persistent vomiting just after the head bump, or they're walking unsteadily and their gait has changed, those are some red flags that you want to get them seen. Any bleeding from the nose and ears or any water or liquid flow from the nose and ears may be concerning from a fracture at the base of the skull. If your child suddenly develops raccoon eyes, which is darkness around the eyes or maybe darkening at the back of the ears, we also want them evaluated. So there are certain height of falls that we consider red flags regardless of how the child looks. We always consider getting them evaluated. It may just necessarily be based on a head injury, but there are other parts of the bodies that you may not be seeing at the time that we want evaluated. We usually say that if your child is younger than 2 years old and they fell from a height that's 3 feet and higher, or they are older than 2 years old and they fell from a height that's 5 feet and higher, we consider those high-risk falls and actually say it's a red flag and want them to be seen and checked out generally. Knowing these red flags not only makes you know that most head injuries are mild and most kids don't have this symptom, but it also helps you get prepared and know what to watch out for and when to rush to emergency or a regular pediatrician if you're noticing any of these red flags. And number 6, if I'm monitoring at home, how do you know if your child needs a head CT, which is a head imaging, or not? Head CTs are usually done to evaluate head injuries when they are necessary. If your child is younger than 6 or 7 months old and they fell down, especially from a good height, we always recommend getting it checked because we can't see everything going on in the head. And even though they're acting normal within the first 20-30 minutes, it may not be a good assessment. So there may be those we need to evaluate and see if they need a head CT. We also decide based on all the red flags I mentioned, if your child has any of the red flags I listed, going to be down in the captions again, they are highly likely to be getting a head CT when they get evaluated at the regular hospital or by your regular pediatrician. A lot of kids may have concussion, which makes them have some headaches, some vomiting, and just generally feels unwell. CAT scans actually do not help us diagnose concussion, usually based on the symptoms. So we recommend them only for those who really need them. We were looking for bleeding, broken bones, or which we call fractures. But for concussions, they're not very helpful and exposes the kids to a high rate of radiation. So a child may not need a head CT if they have a concussion. So now let's do a quick summary of how to respond and how to get you comfortable every time a child bumps their head. 1, assume they did not have a head injury, even though you know they did, but let that help you decide if you need to get them checked out immediately or not. 2, within the first 20-30 minutes observation, let them rest and cuddle on you, give them some pain medicine, give them some frozen veggies around the area, and see how they're doing. If they want to rest and sleep, that's okay. Let them sleep next to you, and you can observe and make sure they're waking up easily to interact with you. 3, let them sleep and get some brain rest. As long as you're able to tap them and they respond to you normally, that's completely okay. If you're having a child who's falling deep asleep unresponsive to you, that is when you want to get checked out in the ER immediately. 4, count how many times you're vomiting. 1 to 2 is okay. If you're getting multiple episodes of vomiting in addition to a child who's not acting normally, or even regardless of that, you want to call a regular pediatrician or consider going into an ER. 5, know what the red flags are. I want you to have this information. It's going to be in the captions below. I want you to know what to watch out for, but then I also don't want you to be anxious and rush into the ER if your child is acting completely normally with none of these red flags. Number 6, it is okay if your child is not getting a CAT scan after the head injuries, but also know that if they have any of the lists in the red flags, it also might be one of the things you can use to advocate for them so they can get the care that they really need. In an upcoming video, I'm going to be talking about these goose egg bumps, how large they are, what they are, how to manage them, and also when to get checked out. Leave me a comment in the comment section about head injuries or share your experiences with your kids. I know kids fall a lot. Or if you have any other questions about head injuries or any other topics, feel free to leave me a comment and a like. And don't forget to subscribe, and I will see you in the next video.